Welcome to the Level 2 Refresher video. This is our new UHP MRI system, and one of the most important things for you to understand about this new system is a new head coil that replaces the previous one that we were using. The new head coil is 48 channels, so it is higher performance, but one of the interesting things about this coil is that it comes in two parts. The top part should normally be on the side when you begin your scan. So we'll connect it. And I recommend that you grasp it here by this handle. And then another thing you can see is that when the table is lowered, it will not reach the ports where it needs to be plugged in. So I first need to raise the table, carefully making sure the ports are out of the way. After you have raised the table and the doghouse is connected to the table, you need to connect your head coil connectors to the ports. So in order to do that, you put the left one to the left side, you turn this lock, make sure that it shows green, and then you should also change to the coils tab, which I can do using the trackball, which is here, and select coils, use the left button in order to be able to select it, and then I can see that the left one is connected, it's green here. Then I do the same with the right one, push it in, make sure that the button shows green, also make sure that this is firmly pushed in, and then you should see that this is green. So now it should be connected and ready to go. Another thing that I would like you to remember to check is our head coil mirror. So unlike the previous 32-channel head coil, we now have a mirror from GE, which is much more stable and solid. Normally, you don't have to do anything because it is not adjustable like our previous mirror. But one thing I would like you to at least realize is that the large side, which is shown here, which is 45 degrees, should be pointed in towards our TV. This side also has a mirror, but it is intended just to allow the participant to see their outside of the bore and reduce the claustrophobia. So this should not be used for the viewing of the movie. Okay, so another thing that you should know that's different about this system is that landmarking is different. Previously with the older 750W, we were using the edge of this table to landmark, so we would press on the edge. But with this system, that is not a capability that we have. So instead, we use laser landmarking. To do that, I would suggest your first step should be to press the button which says back to landmark, because in most cases, the previous scan was landmarked similarly for the head. Sometimes it will be a completely different position, and the way that you can tell where the landmark is right now is to use the trackball to go to patient setup screen, which is the one on the leftmost here. Press the left button, which is left of the trackball, and now you can see where the laser, or where the landmarking is set, which is normally in this position for head. If there had been a previous scan that was completely different, then this green line would be moved down. So I'll advance to do the back to landmark button here. Push that, and I'll turn on alignment button, which is shown with a light bulb icon. And then you can see a landmark for the laser, which is close to being aligned with this ridge. I can adjust that a little bit. This puts the person more inward. This one puts it more outward. And I'll just adjust it. And then I press the white landmark button, and then I would send the participant in with the advance to scan button. Another thing that you should know about using this head coil is that after your scan, you should not leave it plugged in like this. Normally, after your participant is brought out, then I would take the top part off, like this, put it on the side. And then I would also unplug this port and leave it here. And the reason for that is because if I lower the table, this will no longer reach its port. And it's not advisable to be pulling this port out every time that you lower the table. So please remember to do this, because even if you're not lowering the table, perhaps the next group will, and forget about this is being connected. Another additional feature of this head coil is that we can expand the head coil in the anterior-posterior direction of the head. That's done with this insert, which just sits on top of the bottom part. And then you can bring on the top part, and then connect the ports as usual. Okay, I want to make you aware of a few differences between the new equipment room compared to our old one. One is that over here we have the helium alarm instead of on the far cabinet. So everything else about it is the same, so I won't discuss it. Another difference is that the emo reset that was here is now over here. Finally, I would like level 2s to be aware that because we don't have clinical scans on this scanner, and therefore the techs are paying a little bit less attention than they were before to our scanner, that I would very much appreciate it if you make an effort to, after your scan, especially if there's a large gap between your scan and the next scan, or if it's the final scan of the day, that you use the small key here to lock up the MR room, and of course return the keys here to our drawer so that we can keep it a little bit safer. And I would also appreciate it if you would lock this screen, which is something that we did not have as a feature before. So you can lock it like that so that it's a little bit more secure. And this one you can sleep or lock. Thank you for your attention. That's the end of the level 2 refresher.